My name is Swapna Kakani, and I'm born and raised in Huntsville, Alabama, to immigrant parents from South India. And I was born with a rare GI chronic disease called short bowel syndrome, where from birth I have lived on TPN and tube feeding. Through this journey, experiencing healthcare at a lot of different access points, a lot of different hospitals, healthcare systems across the country, learned really the hard way how important it is to empower but also increase the patient voice and to be treated as a team member on the healthcare team. And I made it my mission to work on that, to increase the patient voice across the healthcare spectrum, to hopefully change how healthcare is delivered to the patient and family. Growing up in Huntsville as a second-generation Indian American was very interesting and continues to be an interesting and unique part of my life. Growing up in Huntsville, we were very fortunate to have a very strong Indian community, and I have very strong childhood girlfriends that are Indian and their parents immigrated as well, and we could relate a lot in our experiences. Being born in one culture, but growing up in a totally different culture, in a pretty significant culture called the South. I think one, geographic inequity in access to healthcare. Now, I'm grateful for what we do have in our own backyard, but my journey has shown that right care at the right place at the right time is imperative, and it may require traveling for us 12 hours away for the care that I need to live, to survive. And then racial inequity, being a minority, and then gender inequity, being a woman. And I have recognized both in my family and in myself clinicians that just don't respect what a woman says, period. Being the advocate and being an informed patient is a full-time job plus more. And we sometimes diminish that based on how we appear or show up. And a lot of us are showing up at 110% because we cannot sacrifice anything, because we know the minute we sacrifice anything in the care management, anything in how we show up, the whole thing will fall apart. And we're constantly taking care of the other inadequacies that are happening in the healthcare system and trying to also prevent it for the next generation, because we've already experienced it one too many times. We want help, we want collaboration, we want to be heard, we want to be listened to, but we really want to work together with the healthcare system, patients and caregivers. All of us need resources and collaboration in getting along to be able to move that needle forward. And unfortunately, I still feel that each one of us in the healthcare team is operating in a silo. And it just doesn't work. It's incredibly important for any stakeholder in healthcare to partner with the community that has the connection to what's going on at the ground level. The end consumer are the patients and caregivers that are in the day in and day out in our healthcare system. And the only people who know that are the people who are living it, and then the other community leaders, community organizations who have that connection to that, what we call that wisdom. Who better to communicate and partner with than individuals who know firsthand? And in health equity, I think a big core part of the problem is that people who are experiencing inequities are not being asked, are not being listened to. So let's start asking the questions, because I think a lot will be unearthed, and let's start asking the people who are experiencing it firsthand.